Bismillah ar-Rahman ar-Rahim. Today I will speak about an important issue, which is the lung-kidney interaction in disease. The lung-kidney interaction in disease, or the pulmonary renal link in clinical practice. First, I will talk about how does the lung diseases affect the kidney. Of course, the impacts of lung disease or pulmonary disorders on kidney functions, they are significant, and lung diseases have serious negative impacts on kidney function at any stage of their biological progression, that is, whether in acute or chronic lung diseases. As regards the acute lung diseases, in patients with pulmonary edema and in patients with pneumonias and in patients with pulmonary embolism, we have deleterious consequences on renal functions due to inflammatory process or systemic inflammatory flare-up, and the hypoxemia, which are consequences of such acute lung conditions, especially pneumonias, acute pneumonias, and acute pulmonary edema, whether the cardiogenic pulmonary edema or the non-cardiogenic pulmonary edema, or what we call the adult respiratory distress syndrome. And also in patients with acute pulmonary embolism, especially acute massive pulmonary embolism with circulatory collapse, which might be complicated by renal shutdown even, and is a life-threatening condition with high mortality if not managed early. Also in patients with chronic lung diseases, obstructive airway diseases, including the reversible bronchial asthma and the irreversible emphysema and the chronic bronchitis, COPD also, or obstructive airway diseases, they have deleterious consequences on renal functions due to hypoxemia and due to inflammation and due to endothelial dysfunction, which affect the kidneys, and they might cause renal insufficiency, and in advanced cases they are even complicated by a sort of chronic kidney disease, and this is the chronic kidney disease complicating obstructive or chronic obstructive airway disease. Also in patients with suppurative lung disorders, including bronchiectasis, chronic lung abscess, infected cystic lung, all these suppurative lung conditions might be complicated by renal insufficiency and renal failure due to systemic amyloidosis or secondary amyloidosis complicating chronic lung suppuration, especially in chronic bronchiectasis and chronic lung abscess. Although they are rather rare now, but still, when they are met with in clinical practice, we should not forget that as a part of the natural progression of such disorders, they might be complicated by systemic amyloidosis, and amyloid might involve the kidney, causing nephrotic syndrome, and with further progression they might develop into chronic kidney disease and chronic renal failure. So amyloidosis causing nephrosis and causing chronic renal failure is a recognized complication of chronic suppurative lung disease. Also in patients with interstitial lung diseases, a third category of chronic lung diseases, interstitial lung disease, which is characterized by interstitial inflammation and scarring, fibrosis, which is caused by many diseases ranging from environmental pollutants, chemicals, medications, connective tissue diseases, and other causes of interstitial lung disease, like mixed connective tissue disease, scleroderma, dermatomyositis, polymyositis, Sjogren syndrome. These are all examples of diseases causing interstitial lung disease, and interstitial lung disease is characterized by a cough and shortness of breath, and they affect the what we call the alveolar capillary membrane and cause hypoxemia, and the hypoxemia associated with interstitial lung disease. On the long run, they and also the systemic inflammation associated and other comorbid conditions which might involve both the lung and the kidney, like in patients with microscopic polyangiitis, which affect the interstitium and the lung and cause interstitial lung disease, and at the same time they might affect the kidney by another pathology being a cause of glomerulonephritis. So such type of vasculitic syndromes, they might also be associated with renal complications and clinico-pathological implications ranging from nephritis to nephrosis to chronic renal failure in advanced cases. So the effects of interstitial lung disease on the kidneys is well recognized, causing a wide range of clinico-pathological renal complications, starting from asymptomatic urinary findings like proteinuria and hematuria to symptomatic renal disease, including nephritis with nephritic syndrome, nephrosis, that is nephrotic syndrome, and even in terminal cases, chronic renal failure. So the renal complications of interstitial lung disease also is well recognized in this issue. So this is the, in short, how does the many lung diseases can affect the kidney, and they cause renal problems, which might fall into any of the four main categories of the renal clinico-pathological syndromes, which are: number one, asymptomatic urinary findings, most commonly hematuria, whether microscopic or macroscopic, and usually microscopic hematuria, proteinuria, and other urinary findings. This is number one. Number two, acute nephritis due to acute glomerulonephritis causing acute nephritic syndrome. Number three, nephrotic syndrome due to also glomerulopathy with all its range. And we all know that nephrotic is massive proteinuria, hypoalbuminemia, and edema with generalized tendency to infections, and hyperlipidemia in many cases, and of course can be complicated by hypercoagulability and by recurrent infections due to immunocompromisation. And then the last clinico-pathological renal syndrome is chronic renal failure. So chronic lung diseases can cause any one of such renal complications. By this, I will end my short presentation, and wait for me in the next presentation. I will continue talking about the lung-kidney interaction in disease.